Okay, welcome back to Edu Skills OET made easy. Our mission is to make you fall in love with OET. Okay, today we are dealing with the reading part A. I'll be teaching a different method. This is specifically for those who find it very hard to crack and get maximum score in part A. If you're watching this on YouTube, kindly consider subscribing the channel. Give us a thumbs up if you like our work. And please share the video to others so that we reach out to maximum number of OET aspirants, especially those who are financially struggling to crack OET. Today, we'll try to go slow so that you learn patience. That's the key for success. And OET 2.0 Occupational English says, TOPS test reading part A. And you know, reading part A has 4 texts, text A, text B, text C, and text D. But then all these 4 texts have one theme, single theme. And normally there is a sequence, as we said, maybe definition, diagnosis, management, monitoring. So there will be some sort of sequence, one theme, 4 texts. It will be in a logical order. And as you know, 20 questions you have to complete in 15 minutes, but we suggest you to practice to complete in 10 or 12 minutes, which you can definitely do. And our greatest enemy is time. Try to defeat every time, defeat your greatest enemy. Means it's a expeditious or fast reading task. You shouldn't be taking too much time on each text. Just glance over. We call it the skill to skim. We'll learn those things as well. What is the expected grade, band, or numerical score? It's expected at Edu Skills is 450 to 500. If you don't want to score 500, if we give you a concession of 50, at least score 450. You should have this particular target in your mind. Otherwise, you will land in 340, 330, 320. I've seen hundreds and thousands of people landing in such scores. So always try to practice for 450 so that at least you are somewhere above 400. Now, if you have to get a grade A in reading, you have to get minimum 18 out of 20. But we suggest definitely you can go for 20 out of 20 so that even if you miss some answers in part B or C, you can be reading part A in 10 minutes. That's our target, okay? When you reach 10 minutes, definitely you have 20 right answers. You can go for the exam. First thing, as you take up your reading part A practice, what you have to do? You have to identify the 4 text headings. What are the headings? Then write down on a piece of paper or on your notebook. Understand the relationship and sequence among the 4 text headings. Now, second step, try to understand, is there a sequence here? First one says description. It explains the disease or the condition. Second one speaks about diagnosis. Okay, something about investigation, all those tests and other things. Third one is treatment. Okay, I know. After diagnosis, we have treatment or what we call medication. Then we have management, or here we have prevention. So there is a sequence. Try to understand this particular sequence or relationship. Step to begin with a skim. As you glance through, just get a general idea, and I'll tell you what are the things you have to look into. Focus of each text. What does each text focus on? Just focus, understand as you skim, look at the headings. Skim, search for clues. Clues like title, section headings, subheadings, names, numbers, percentage, sequential expressions, frequency expressions, scales, adjectives, negative expressions. These are the clues you can look for, and definitely you will have the answers over there.
Now I am going to show you this particular this text. Now for skimming part, you need to just look into this is first test A, speaks about the definition or description of the thing. The subheadings you have diabetes, type 1, type 2, gestational diabetes, pre-diabetes. That's all you need to look into in skimming. Then you have text B, clinical assessment. So what are these lists? They are the symptoms. Then you have PGBT, then further investigation to confirm diagnosis. Text C, managing diabetes. You have the management part of it. Then you have monitoring a person with diabetes. What is to be done? Let's see how you can work out. Now let's see, this is first questions 1 to 7. The first one is description or definition. A. B is clinical assessment. C.
Management. D. Monitoring.
Annual eye screening, where it comes?
B.
Precedes, what precedes diabetes? Precondition of diabetes, where it comes?
Definition.
SB1 is insulin replacement.
Management.
And habits needed for good diabetes management.
C.
Ultimately, you have there management. Already
Yeah,
you have the
management.
answer there.
Yes.
And most common side effect
Monitoring.
D.
and indicators that a person might be diabetic. Indicators means
D.
symptoms.
Symptoms.
And
B.
how,
B. B.
yeah. And how many seconds you require?
Then 20.
Yeah, you need not even 5 seconds for each answer. I'll just show you the highlight thing. See, analyze screening, pre-diabetes,
Definition.
A definition, HbA1c, monitoring, insulin replacement, management, habit, management. That already answer is there, diabetes management. Okay, now try reading these questions without, we are not going to the text at all. Let's see how far you can identify the thing. What is the prevalence of diabetes?
What
Who
is the
have type
prevalence of
1?
diabetes?
Don't tell me the answer. What are they expecting there? A number, name, or
Number.
yeah, which organ is not working correctly leading to diabetes? What are they expecting?
Yeah, pancreas.
Organ.
So which organ? From that itself, that is called skimming the questions. Okay, which organ? So you know
Okay.
the answer must be an organ.
Yes, yes,
Okay.
yes, sir.
Other than the should be a number. Now the third one.
What is the most usual
Medicine.
Most usual
Maybe
treatment is the
Management.
you have to skim
Yeah,
just that
management.
expression. Most usual treatment. They are asking for what type of treatment. For example, do you go with the insulin first, or you do go with oral medication, or do you go with whatever? Manage the most usual treatment. They are asking for a type of treatment. Next one.
How often is it appropriate for a woman with gestational diabetes to test her CBGT if she is taking oral medication? Maybe time.
How
How
often?
often?
Yeah, time means daily or once in a week or once in 3 months, once in 6 months. You know what is the nature of the answer going to be.
Yes.
Then next one.
How are the most common effects of having diabetes monitored?
Yeah, already you know where which text monitoring. Okay.
Yes. Yes.
Common effects. You have to find the common effects there. Okay.
If a person cannot keep their blood glucose level stable, what device might they use to administer their insulin? What is the device? We should find out.
One device. They are asking for the name of a device.
Device. Yes.
And it is singular. Mind it. It is singular. They are not asking for devices. Singular.
Device. Yeah.
Okay. And they trick you most of the time. There will be 2 devices or 2 things given. You will be writing both. And your
Okay.
answer will be
Wrong.
tricked that way. So you should, they should know whether you can identify the singular and plural form.
Okay.
Okay. So that's a trick they usually play. Next one.
Which type of diabetes can be prevented by making changes to diet and taking up an exercise regime?
Which
Yeah.
type?
Management.
Type of diabetes.
Diet and diet and
Diabetes.
diet of what type of which type of diabetes out of 3? Type 1, type 2,
Type 1
gestational.
gestational.
You have to say, yeah, you have to just search for one. And where you have the word diet and exercise.
Exercise.
So next one, 15 to 20.
Number. Maybe the number.
Result of number. Yes.
And
Okay.
higher.
Number. When you skim through the text, you need a number there.
You need the digits.
Once you know which text it is and
You can go
what is
directly.
required, number means you have to look only for number there. Nothing else.
Yes.
Next one.
A person with diabetes out to see a doctor if they have a cut to a dash.
Cut to a what? Where should they have a cut in the legs or arms or eyes or a head? Then next one.
Diabetic eye staining is a half-hour long eye dash that can pick up any early signs of damage to the dash in the eye.
Monitoring. We have to
Yeah.
A routine diabetes check involves pulse and blood pressure checks, urine analysis, and a dash test.
Yeah.
Type 1 diabetes is most predominant in children and adults aged.
Yeah. What is the age number? Definition.
Type 1 diabetic patients check their CBGT before dash and administer an amount of dash based on the CBGT.
Management.
procedure.
You know,
Amount
yeah,
of
usually usually before where do you use? Before in the medical terms? Before the meals, after the meals, before
Yes, sir.
supper, after supper, and
Management.
administer an amount of how many doses? 2 tablets, 1 tablet.
amount
Okay.
of, yeah.
So we are just going into the text, highlighted text. You see, first one should be, you should, as you go through, type 1 is the indicator for all so many answers, right?
Yes, sir.
Age
Age
under
under
30.
30.
Pancreas cannot be prevented with diet and exercise. Type 2, strongly linked to
Strongly
being
linked to
avoided
being
and having
avoided.
lifestyle exercise, lifestyle changes. And most common side effect. Whenever you use most, when there is a superlative, usually there is an answer or an adjective, high, low. And going to the next one, see, clinical assessment. The word symptoms, indicators. Then you know all the tests will come here, urine analysis, check pulse, blood pressure, CBGT, all these will these are the things there. Once symptoms means, this list is about symptoms. You need not go to everything. Only where if they have asked for a particular symptom, you can go there. Actually, in this, they haven't asked for a particular symptom. Okay. Now,
Okay.
oral glucose tolerance test, the number you require and the test name. Now again, managing diabetes. What is the most common medication?
Oral.
It's oral medication.
Oral
Then
medication.
you have the insulin. And device was asked.
Pump.
Device was
Yeah,
asked.
yeah. Yes, yes.
Yeah.
Yes.
Pump.
Pump.
Or using pump. Yes. And the fluctuating blood glucose levels. See, before meal. CGBT? Before
Before
meals.
meal.
meals.
Yeah. Yeah. When there is a chronological
Amount.
approach, usually there is an answer. Before, after, next, another, all those chronological expressions, no? Or less frequently. Through an insulin pump.
Device.
Yes, device. Regular
X.
monitoring a person.
Mm.
The annual diabetic eye screening. Annual means already chronological expression is there.
Mm.
Yeah, damage to blood vessels in the eye. HB1AC levels should be maintained below
7%.
7.
Plus 7%.
Appointments with the doctor. Cut to a
Yes.
Lower
cleft
yes.
Lower.
blister or a graze to a lower limb. The caution here is you have to write exactly same words in form, tense, and number. You can't even avoid one article. You can't just say past tense instead of the present tense. Anything that transformation is done, that answer will be considered wrong in part A. Okay? You have to exactly take the answer, take the words from here, from the text, and write it in your answer. So these are the answers. First one we saw within few seconds we could manage that, right? You can manage this within 7 seconds, definitely. So I'm going a little fast because I just want to give you an idea about the strategy. Then you will work out by yourself, okay?
Okay.
And we'll have a discussion after that. I want to tell you the answers are so easy. You can easily get from the text without even reading the whole text.
Okay.
All these number, you wanted a number,
Yes, tolerance test.
and number is here. And which limb, lower limb, which, and the eye screening is half an hour long eye examination.
Mm.
And early signs of damage to definitely an organ, no? It should be an organ, something, blood vessel. And here you see there is a tricky answer here. If you write CBGT, that is wrong.
Okay.
Why?
Yeah, CBG.
Because it is CBG, not CBGT.
Yeah.
Test.
Because test is already given
Just
there.
already given there.
Yes, sir.
So usually, normally what happens, you will find it so easy, you will write capillary blood glucose test, the whole thing. The answer is wrong. These are the tricks they play with you. You got it? No, already test is given in the question itself. So you have to write only these 3 words. Take a caution of those things. But sometimes you feel it was very easy, but you have a lower score because of these things. These are tricks you should defeat. Okay?
Yes,
Is
sir.
that clear?
Yes, sir.
Yeah. And part 1, never ever change the form, never ever reduce the word or number or change the form of anything. Exactly pick, collect, cut and paste. Just collect the same word and write in the answer. Any one spelling difference or spelling error, typos will be penalized. Type 1 diabetes is predominant in children and adults aged under, there is a number required which was under number, I have it there. See, before meal and administer an amount of insulin based on the CBGT value you set, but it is result almost same answer. Okay, but then you'll have to get the same word from the test. Is that clear?
Yes, sir.
Yes, sir.
Yes, sir.
Getting back to that, so